the United Center, getting ready for the Bulls and the New York Knicks. Our injury report brought to you by Athletic Co., chosen provider of rehabilitation, fitness, and performance services for the Chicago Bulls. The New York Knicks without the services tonight of Carmelo Anthony, Jose Calderon, and Alexei Shved. Tim Hardaway Jr. doubtful with a sprained right wrist. For the Bulls, Derrick Rose still out, and Doug McDermott questionable with back soreness. Back here on BMO Harris Bank pregame live. We're getting ready for the Bulls and Knicks, third meeting of the season between the two teams. Bulls 2-0 against the Knicks this season. So I have to be joined by one of the Bulls team doctors, also a team doctor with the Chicago White Sox from Midwest Orthopaedics at Rush, Dr. Brian Forsythe. And Doc, thanks so much for joining us. Dr. Forsythe is a specialist in shoulder, knee, and elbow surgeries. So Jimmy Butler just missing 11 games. He's been back for 2, but he had the interesting elbow problem, and it didn't look like much when we saw it happen here on that Sunday against the Clippers. But what can you go into detail what he had?
Sure. You're right. It didn't seem like much initially, but what he had done was he sprained the ulnar collateral ligament of his elbow. It's basically the restraining ligament on the inside of your elbow, which is very important for preventing instability events. It was a minor strain. He also sustained a bone bruise. Fortunately, this has gone on to heal pretty uneventfully.
Doc, how do you treat something like that?
So initially, we just try to control the symptoms of pain, swelling, and inflammation. From there, we try to get range of motion. We then progress to some strengthening and then some neuromuscular training just to get the coordination back.
Fantastic. Well, how common in sports and how painful is something like that? And you see it, I guess we see it with major league pitchers and maybe even minor league pitchers and high school pitchers. But do you see it with the Weekend Warrior a lot?
Oh, we do see it with Weekend Warrior at times. Jimmy's injury was more traumatic. I think what you had been alluding to was sort of the overuse phenomenon, which we're seeing in younger patients and in particular baseball players who are really putting tremendous loads on that ligament over the course of a season. We are seeing more of it. It's almost an epidemic, and I think by and large we're putting too much emphasis on playing year-round, and it's time for kids to take a break.
Yeah, what kind of break do you suggest? Because the overuse injuries in youth sports is almost an epidemic, isn't it?
Yeah, I mean, it's recommended that we take 3 months off a year. Most kids are getting 1 week between Christmas and New Year's, and they look at you like you're crazy when you suggest that 3 months is an adequate period to rest and let your body mature and recover.
And how about for the youth out there? Do you always recommend more than one sport?
Yes, I think cross-training and playing a variety of sports is important in terms of development of your physicality, and it's good for them. It's good for them in general. I think that many of the skills that they learn from one sport are transferable to the next, and over-specialization early on is probably not the right thing to be doing.
Dr. Brian Forsythe with us from Midwest Orthopaedics at Rush, getting ready for the Bulls and Knicks on our BMO Harris Bank pregame show. Doc, the biggest medicine story right now in the NBA is about Kevin Durant of the Oklahoma City Thunder, one of the best players in the league. First had a Jones fracture in the foot and now needs a bone graft, and he's out for the season. Yeah. Can you explain the Jones fracture and then the bone graft?
Sure. The Jones fracture is a fracture in one of the metatarsals, the fifth one, which is on the outside of the foot. It's a somewhat common injury, unfortunately, and it's particularly difficult to treat because the blood supply to that region is not very good. So, between 5 and 8% of the time after you fix these surgically, they don't heal. And what we do with the bone graft is we add bone, which is borrowed from elsewhere, either the shin or the pelvis, and we take that spongy cancellous bone and graft it to the fracture site to sort of promote substrate for healing and to try to stimulate a better healing response.
Is that a common surgery?
I wouldn't say that it's that common, but it certainly happens. And 1 out of 20 of the times we do this Jones fracture fixation procedure, this is sort of the next step in management.
Terrific. Hey, Doc, thanks so much for joining us and lending your expertise from Midwest Orthopaedics at Rush.
My pleasure. Thanks for having me.
Dr. Brian Forsythe, a team doctor for the White Sox and our Chicago Bulls. Stay with us, folks. We've got Bill Wennington coming up next on Bulls TV and the Bulls Radio Network.